Hi, I'm Dr. Vijayendra, the director of the Healing Zone. As one of our patients, we would like you to be completely in the know and have a deep understanding of the subject of cancer. Now, cancer is a word that very often is being misunderstood. There is a lot of fear attached with cancer, and often there is a fatalistic undertone attached with cancer. But many probably do not understand what is cancer. If we are going to solve your cancer problem, it is important you have a clear understanding. Now, in this simplest understanding of cancer, it is a group of diseases which is typically characterized by an uncontrolled growth and spread of abnormal cells. In another way, cancer is not necessarily just it does not grow too much, but it dies too little, because one of the characteristics of cancer cells is it does not die. So if we were to look at how normal cell division occurs and how this is a very much controlled process, and cells die and they get replaced by new cells. Now, in cancer cell division, things are actually abnormal in the sense that a cancerous cell will continue to divide and continue to divide. And this is the start of the problem. And while normal cells are very well defined, they have clear borders, well seen nuclei, and they have an orderly pattern to things. But in cancer cells, because they grow uncontrollably, they lose many of these features. There is abnormalities within chromosomes because they are dividing too quickly. The cancer cells lack a clear and defined border, and many other characteristics which we will see in a later presentation, which will look at what are these characteristics. So cancer, therefore, is an abnormal behavior of cells, and while it is still small, it doesn't cause any clinical problems. But once it achieves a certain size, then it starts to manifest, and often it starts to manifest at the organ where the cancer originates. So it can be in the skin, if that's where the primary growth starts. It could be in the uterus and present with symptoms which are related to that organ. But very often these initial cancer cells are not a major problem, because typically the body's immune system will deal with this. But when that fails to take place, then you have the potential for cells to break away. And in fact, we now know that cancer, even when it is very small, that little cells which we call cancer stem cells break away and circulate in the rest of the body. And this is a very important thing to understand, because unlike our past understanding that we used to stage cancers purely from anatomical spread in local region and distant metastases, we now recognize that such spread occurs very early. Okay, and for many cancer patients, the complications or death is often due to metastasis. So, cancer starts in a certain unique pattern, and it leads to abnormal cells which behave in a certain set way. The importance of this is conventional cancer approach often views this as a dangerous group or cluster of cells, and that they ought to be killed somehow killed or destroyed. From the healing perspective, which is what we would like to educate you about, we see that by understanding the unique characteristics of these cells, we can take, well, you may say, institute behavior modification, and like instead of it dies too little, if we could help the cells die through a process called apoptosis. So there is an important value to understanding that cancers do not always need to be killed or destroyed, that they can be rehabilitated through healing-based strategies. It is hoped that this will help you take the next step, which is to learn what you can do to change this cancer cell behavior. Thank you.